All right, today we're going to get started talking about digestion and systematically healing the gut. Whenever we tackle systemic issues, whether it's inflammation or fatigue or joint aches and pains, or even just optimizing an already primed system, we must focus on attention to the gut. Our body is regulated by so many different hormones, neurotransmitters, and ultimately the nervous system. The nervous system is what connects us and really is that signaling component. Interestingly enough, our gut holds the entire autonomic nervous system within it. There's actually more neurons in our gut than there is in our spinal cord. So it's an incredible area of focus. If your gut is not happy, the rest of your body will not be happy. If the rest of your body is signaling an area, it actually tells the gut that something is wrong. So we're going to focus on specifically healing this major indicator for problems that can arise in our body. So we refer to this as the Vitality 5R program. This is something that we'll come back to frequently, and just to keep it really simple and to know exactly what we're doing. We're going to do 5 things: remove, replace, reinoculate, repair, and rebalance. I like to think of your gut as kind of like this amazing garden or amazing field. Remove is like weeding the garden. Replacing, this is replacing digestive enzymes and those critical components that actually allow your body to break down food into usable forms. The third is reinoculate, and I like to think of this as seeding your garden. We like to seed the gut with really good bacteria, create that nice balance. 4 is repair, and of course this simply refers to repairing the gut lining. So it's this incredible membrane that allows very selectively what goes in and what goes out. And the 5th is rebalancing. You know, we have to prevent that gut from getting to the place where it got previously. So rebalancing the influences that actually got your gut into the bad situation it might currently be in. The first thing we're going to do when we talk about remove is simply address the standard American diet. First thing, very simple, we're going to remove it. So it's such a high diet of processed foods and high fructose corn syrup. There's so many chemicals in our food that we can't even begin to imagine that have been used for the past 10, 15 years. So simply, we're going to remove the standard American diet and replace it with wholesome, whole foods that your body already knows. With the standard American diet, we know right now there's such a lack of vegetables and fruit. So we're going to focus on replenishing those sources. We're going to really take that animal protein portion down. It's such a huge component of what people eat right now, and they're good and nutritious, and there are things that we need. But right now, the balance of how our diet works is really out of proportion. We're also going to remove things like stressors. So get rid of the things that negatively affect the environment of the gut tract. We have allergic foods. So this could be something that you're truly allergic to. So say, for instance, peanuts. You know, if someone you know has an allergic reaction to peanuts, that can be life-threatening. But there are so many foods that our body will tell us, this does not agree with me. Those are allergenic type foods or sensitivity foods. And so we will really work to get those out. A lot of different foods actually induce leaky gut type symptoms. Of course, gluten is by far the most common one for this. We also have medications that really work to inhibit the normal function of your gut. Things like proton pump inhibitors are one of the major areas, but also anti-inflammatories like ibuprofen or Aleve. Parasites, potentially problematic bacteria or yeast, again, another area that we find so often creating complete dysregulation of our gut environment. So along with the standard American diet, we're going to remove some of those things that actually stress the gut lining and allow it to wreak a little havoc. So what we're going to do is for 3 to 6 weeks, we're going to go on this elimination diet. Now, an elimination diet is really just removing the most irritating foods that go into our body and allowing our body to heal. So, of course, processed foods, packaged foods, high fructose corn syrup that we mentioned. A lot of the canned or dried foods have a lot of nitrates in them, which can be very harmful to our gut. We're going to just cut out all grains for the first 3 to 6 weeks. It's a really amazing process of how cutting out these irritating foods can actually decrease the inflammatory response in our body. There's something called epigenetics and nutrigenomics. These are crucial concepts. Basically, food can act like triggers to certain genes, turning them on and turning them off. Keep that in mind as we continue on through the course. Our ideal situation is to optimize everything that happens from a biochemical basis, a signaling basis, and a hormonal basis. What I want you to really understand, food can trigger your genes to turn them on or turn them off. So right now we're really limiting the things that can turn those genes into a more negative effect on your body. So it's not just because I want to make everybody feel good, which I know they will notice some differences, but I'm working down at the cellular level, the level of epigenetics and the level of nutrigenomics. It's fascinating. We're going to hear more about it. And the diet is the key. So really taking it, food is medicine, is so important. So after about 3 to 6 weeks, we're going to gradually reintroduce different foods. We'll do this in a really systematic way. It takes about 23 days for the food reactive antibodies to drop by 50%. So that's why we actually focus on that time frame. Now, some of you will need longer amount of time, and this is all personalized. So we will address each person's situation. But just know after 23 days, you have a specific drop of 50% of those food reactive antibodies, so that when we go to reintroduce, you can absolutely tell what is causing your system a problem and what is not bothering it. You know, it's a really great approach, this complete elimination diet, for a lot of people. However, like I said, we meet you where you're at. Some people simply might be just, we're going to remove sugars, gluten, dairy, processed foods, and caffeine. Those are the key components of what we're doing. And there's a world of foods out there just waiting for us to eat it. But those are the main areas that we are going to limit. Other key points, definitely important to increase your water. I want you to focus on what is allowed and not what you're not going to be having for this time period. Remember why you're doing what we're doing. You know, what are your symptoms? Is it pain? Is it lack of energy? Maybe your weight has been an issue that just won't resolve. Concentration or focus, simply how your mind works. These are all important things to focus on as we make these incredible changes that are going to nourish your body. The other thing that I want you to do is find non-food ways to de-stress. Exercise is amazing. It's a wonderful stimulant of our mood hormones, but it also helps just kind of get us away from those food triggers that some people have. Maybe it's just taking a quiet walk, maybe reading a book, maybe doing some meditation, or just getting fresh air outside. Whatever it is that your system needs, I want to make sure that you find those non-food ways to de-stress. So what can you eat? Oh goodness, there's so many wonderful foods out there. We love pastured organic meats. There's so many vegetables that we say eat a rainbow, and eating that rainbow really ensures that you're going to have a high antioxidant, high fiber, highly nutritious type of meal. We have some amazing nutritionists who can be working with you along the way, and certainly if you feel like you're getting into a rut, you know, make sure you reach out to us, because we have access to some of the most wonderful foods. Different proteins, vegetables. As far as legumes go, you know, legumes are typically beans. Chickpeas and lentils are going to be included for most people. If that's not your situation, we will certainly let you know. But chickpeas and lentils, because they're more of a seed-based, are going to be just fine. You'll see in the vegetable component, there's bok choy and broccoli, Brussels sprouts, cabbage. Oh my goodness, there's so many wonderful ways that those are good for you. Garlic has allium in it, and that is wonderful for the digestive tract, but also antibacterial properties. So there's a lot of reasons why we go for all of the diversity that we do. Fruits and nuts and seeds. Oils, we're gonna really stick to ghee instead of butter. You'll see some coconut oil, of course, olive oil, omega-3s to balance off those inflammatory oils in our system. Spices we love, but especially that turmeric and cinnamon for the healing effects that they have in our body. What else do we talk about removing? Well, we're going to really work to remove some medications that are damaging to the gut. Things again like antibacterials, anti-inflammatories, proton pump inhibitors. Those can all be very, very damaging. We're also going to make sure that we get rid of the things like the bad gut bugs, yeast, and parasites. As we test for them and find them, we will be using some herbal antibiotics to really rid our system. So removing standard American diet, removing those inflammatory foods we put in us, and we're going to be removing medications as our body tolerates on this journey to anything that's really affecting the gut in a negative way. We would be remiss if we did not mention removing or managing our stress levels. Stress has an incredibly negative effect on our gut, and as well as the rest of the body. It can stunt the immune system. It triggers inflammatory cytokines that actually make a lot of our issues worse. So we're going to focus a lot on removing or managing how that stress reaction fits in our body. We really incorporate a wonderful treatment called core belief therapy. And during the program, you'll be experiencing this. And it really works with the body to help remove some of those blocks that stop us from progressing in our health journey. So after we've done remove, the next thing we're going to talk about is replace. We must replace the digestive enzymes that are insufficient. Now, these enzymes come from the gallbladder, the liver, pancreas, stomach, especially the stomach. Stool testing really lets us know if they're needed or not, and we can do something called a butane challenge. We'll get to that later in your journey, but replacing those digestive enzymes is very important. We love to do things through live food, as I would say, or just whole foods. Pineapple and papaya are wonderful for this. They have enzymes in them called bromelain and papain, and it has an incredible effect on helping your body digest. The next thing we're moving on to is re-inoculate. So now it's time to reseed that gut with a good bacteria. We need to give it the nutrients it needs to thrive. So prebiotics, some words you'll hear frequently. Prebiotics are undigestible fibers that allow good bacteria to feed. These are very important. Feeding the good bacteria then allows them to produce something called short chain fatty acids that actually nourish your gut lining. So it's a beautiful system. We eat good foods. It gets broken down by digestive enzymes in your stomach. It gets sent to your intestine in a usable form. And then the bacteria feed on that good food. Their byproduct is actually what gives our intestinal lining the fuel it needs to replace itself. So I think it's absolutely fantastic how this whole process works. So prebiotics, again, they're plant fibers. You'll find them in the elimination diet in high amounts. This inulin, or this type of fiber specifically, really feeds that good bacteria. Now, some of you may also love to know that it boosts metabolism. It helps support your body's production of vitamin B and K. It also helps improve bone health by really allowing your body to absorb that calcium and magnesium better. Another category is called arabinogalactans. This also feeds your healthy bacteria and helps keep some of the nasty ones under control. It stimulates your immune system by stimulating those natural killer cells as well. Now, probiotics, these are actually the live bacteria, the living bacteria in our foods. And there's an amazing variety of fermented foods, which has the highest concentration to try. These live bacterial cultures are called probiotics. We can take them in a supplement form, or again, we can get them from our foods. Many different cultures have different bacterial cultures in their food. So it's not uncommon that we'll talk about sauerkraut or kimchi, maybe kefir, fufu and kombucha are all different options for fermented foods if we're trying to get high concentrations of those probiotics in what we eat. Now, probiotic supplementation, there's so much information on the specific uses of probiotics, and there's so many varieties. We're getting to the point where we can do customized probiotics, which is very exciting, truly giving the gut what it needs. What we're going to do is be making very specific recommendations to you about what you should take at that current time. So we know that things will continue to change, and it can be really tough. So a personalized approach has never been more important in taking care of your gut. So quality counts. We will make sure that the correct probiotic is recommended for you. There's a lot of different components that go into choosing that, and diverse species with colony counts are very, very important. So again, we will make sure that we pick the right probiotic for you. So to review, we've talked about removing, replacing, reinoculating, and now we're going to talk about repair. So it's very important in the repair process that we focus on this component because the gut has been quite damaged by our stress levels, medications, chemicals, toxin exposure. There's so many different facets of what goes into affecting our gut. Restoring that gut integrity can involve a lot of different components from a therapy perspective. We might be using omega-3s in your situation. These are fatty acids like EPA and DHA. We might be using things like zinc or DGL licorice root. Bone broth is a wonderful healer for the gut. Slippery elm, quercetin, butyrate, glutamine, these can all play a role. So as we get into repairing the gut lining, you might be hearing more and more of those different supplement terms. This repair affects the levels of inflammation that your gut cranks out. So your gut is responsible for 80% of the inflammatory cytokines that are in your system. So healing that, decreasing those cytokines is exactly why people notice changes in how they feel when we simply clean up the gut. Next, we're going to talk about rebalance. So while we repair, we also move towards this rebalance phase. We have to create an environment for the body to thrive. This is really important because, again, you can eat great, you can exercise, you can take supplements or eat the most balanced, beautiful diet. But if your stress levels are raging, it will limit so much of what happens inside of your body. So it's really important that we keep this rebalance in mind. It's kind of like a teeter-totter, you know, sometimes things are going just fine and life is easy and the teeter-totter balance is one way. And then you'll start to recognize, gosh, maybe I've been a little lax in diet and exercise. And so the teeter-totter goes the other way. And then maybe at that phase, gosh, I'm under way too much stress and it goes back. So keeping that balancing act is more of just an awareness of what your body needs so that you can give it what you need. I love to ask my patients, you know, what brings you joy? What really is one of those soul-inspiring, lifts you up types of things? It could be as simple, it could be a simple comment, it could be a relationship, it could be a sunny day, but find those things that bring you joy. Also think about why you ended up in this current health situation that you are. What are you most afraid of? All of these little thoughts are deep inside, and sometimes they're the things that are actually holding us back from the healing that's actually limiting some of the work that you're putting into things. So we'll be working on this aspect during the program as well. So how do you see your health in the next 5 years, or maybe the next 10 years? Can you make some difficult changes right now in your diet? I know you can, you know, feeding your body and nourishing your body in the most amazing way for just a short period of time to actually change your health for a lifetime. What do you need to do to make that happen, and how can we help? You know, what would it take and what prevents you from moving forward? We are here to absolutely help you accomplish great things, and your body was made in such an incredible way. We can't wait to move forward as you continue on this health journey. You'll find that some of these foundational changes in the beginning can have dramatic effects on your health, and we're just so excited to walk you through that. One thing that I want you to always remember, your mind is an instrument. Learn to be its master and not its slave. So thinking positively and envisioning how amazing your body can work, and envisioning what a full and vibrant life looks like. So keep that in mind. Learn to be the master of your mind and not its slave. So you've made this fantastic choice to get started. It's what a wonderful way to improve your health. As we look back at the 5R program, just keep in mind, we remove, we replace, reinoculate, repair, and we rebalance. You will start noticing some incredible changes happening in your body as we repair the most crucial system at the foundational level of your health. So Feel free to go back, review some of this information. You're going to see it continue to pop up through your journey, and we look forward to continuing our work together.